Hi, my name is Joe Scott. I'm the president and CEO of Jersey City Medical Center, and welcome to the Medical Center Show. Today, we're going to talk a little bit about pain management. We have an expert in pain management who's a member of the medical staff, Dr. Sheikh. We'll be right back.
Jersey City Medical Center consistently receives the highest hospital ranking and ratings in New Jersey. #1 overall hospital in the state, #1 for high-risk pregnancy, #1 for neurological disorders, #1 for stroke, Magnet Award for nursing excellence, A for hospital safety. What makes the Jersey City Medical Center the #1 hospital in the state? Top-rated, award-winning medical professionals you can see today at the Jersey City Medical Center. Make the #1 hospital your first choice, the Jersey City Medical Center. Jersey City Medical Center, Hudson County's #1 hospital, as ranked by U.S. News and World Report. Hudson County's only hospital to receive an A safety score rating. Jersey City Medical Center is Hudson County's only hospital to receive the prestigious Magnet Award for nursing excellence. Make the #1 hospital in Hudson County your first choice for quality health care. Jersey City Medical Center. Visit us on the web at libertyhealth.org.
Welcome, Dr. Sheikh. We're glad you're here on the Medical Center Show.
Thank you.
We're so glad to have you here. Tell us a little bit about yourself, your training, education, where'd you go to college? You look like you're so young, you can't be...
Well, I went to college at Lehigh University.
Okay.
I did biochemical engineering,
You
bachelor's,
did?
and
Okay.
then I worked actually in industry for 3 years down in Houston, Texas.
Okay.
And then I came back to med school at Thomas Jefferson in Philadelphia.
Oh, you did? Okay.
Yeah, and then I did a year of surgery, general surgery at Cornell Hospital in New York.
All right.
And then I went back to Jefferson for my anesthesiology residency.
Okay.
And then jumped back to New York, played a little leapfrog,
Yeah.
back to New York for a fellowship in interventional pain management at Cornell, HSS, and Memorial Sloan Kettering.
So, interventional pain management. Tell us a little bit about what that means.
Right, so pain actually is one of the most common doctor's office visits after the common cold.
Okay.
Pain management is a subspecialty of medicine which deals with evaluating, treating, and diagnosing several pain conditions.
Okay.
Pain is very complex, so it has a large spectrum of pain pathologies. It can be anything from orthopedic pain with joint pain, osteoarthritis, rheumatoid arthritis, to cancer pain. The most common one we do see is back pain and neck pain, which is spine pathology. So pain management encompasses multidisciplinary approaches to treating different types of pain.
Okay. But when you talk about interventional pain management, so you do procedures that help people manage their pain. I mean, you probably also prescribe medication and everything
Correct.
else.
Right.
There's some people who just prescribe medication who can't do what you do in terms of these interventional procedures.
Correct. So there's different modalities of treatment for pain.
Mm-hmm.
You can treat them with physical therapy,
Right.
medical management, but you can also treat them with certain interventional procedures.
Okay.
The interventional procedure philosophy is more of going towards the source and pain generation of pain,
Right.
and helping fix that problem.
Okay.
So you can manage your pain if you have chronic pain like diabetes or rheumatoid arthritis. You can take medications for it, but if you have spinal pain or certain pathologies that can be fixed,
Mm-hmm.
you can do nerve blocks or spinal procedures or even more
And that's the
advanced procedures.
interventional piece that you're
That's the
talking about.
interventional piece,
Okay.
correct.
So when people need that kind of treatment, and we can talk about some of the pathology around why people need those kinds of treatments, you take them to the operating room?
I take to the operating room. Typically, it's most procedures are all done in local and
Okay.
sedation. It's a day procedure.
Meaning they don't have to be asleep or anything. They
They
can.
don't have to be generally anesthetized.
Okay.
There's no tube. It's just a little bit of midazolam or fentanyl, maybe some propofol. They take a small nap. They get
Right.
the procedure done. It takes roughly 10, 15 minutes, and they go home the same day.
Really? So is this mostly people with back pain or any kind of spine? I see you have a
Right, spine model. So majority
model.
of patients that I see in the office are back pain and neck pain related. I do see other orthopedic or neuropathic or cancer pain as well.
Okay.
But the majority we do see is back pain.
Mm-hmm.
And most of that stems from pathologies in the spine.
Okay.
I did bring a spine model to talk about it briefly.
Sure.
So in the anatomy of the spine, we have vertebrae, which are bones. They're
Right.
stacked on top of each other. And between the bones, we have small cartilages called discs.
Okay.
In the back, there's a canal where all the nerves sit back, and they run all the way down the back of the spine.
Oh.
Sometimes what happens is these discs, if there's increased force placed on the spine, they can bulge out or herniate out and start pressing on the nerves.
Oh, I see.
Okay.
And that's where the pain comes from.
That's where the pain is generated from.
All right.
Now, it's not only mechanical pressure, but there's also chemical involvement, which irritates the nerves, and the nerves swell up. Now, the nerves sit inside a canal, which is made of bone, has a fixed volume. So there's really nowhere for the nerve to go. It's like trying to put on pants when we're in high school. It's going to be kind of tight
Right.
around our waist. So what we do is we sometimes do epidural steroid injections.
Okay.
Steroid is a very strong anti-inflammatory, one of the strongest ones we know. And we place that in there, and the swelling comes down, the compression is relieved, and the pain gets better.
And is that a permanent fix sometimes, or?
Sometimes it can be. It all depends how much of a herniation or bulge you do have. If it's a small one, a couple shots, and they're good, and
Right.
they may be okay. Sometimes if they're longer, other therapies are available for them to pursue. There's other spine pathologies that are involving the facet joints, and what they are, they're small joints in the spine,
Okay.
just like our knee and elbow, but they're a lot smaller. And sometimes over time, patients may develop some arthritis in their spine. So they have back pain, which is more axial in nature. So what we do for that, we do procedures where we inject small medications around the facets to allow to relieve the pain.
Okay.
If they do get better, we can even do small burns, which can give them relief for up to 9 to 12 months.
You said small burns?
Small burns. So what that is called Rfa Radiofrequency Ablation.
Right.
And what we do is we place a small needle on the joints, and we send electric current through the needle. It heats up the tip, and there's small nerves called medial branch nerves which innervate these joints.
Okay.
And we can kind of buzz them or kill them off.
Oh, I
the
see.
nerves die off. When they do that, the pain source is relieved. They do grow back. They
Right.
regenerate over time, but nerves grow very slowly, so they may take 9, 12 months for it to come back. And in the meantime, they're kind of walking and functioning better
Wow.
with pain.
So really, that's a whole different type of pain management than someone just going to the doctor and
Correct.
saying, you know what, I got a backache, give me some Percocet, and
Correct.
you know, hopefully that'll take care of my
Right.
pain.
In the past, chronic pain was one of those things you had to live with. But now with advancement of medicine and so forth, there's a lot of new techniques and options available for patients to
Right.
pursue to help with their pain.
So the people that you deal with, all ages, sports medicine. I mean,
Yeah.
who's the typical person walking into your office?
Usually typical patients are in their mid-40s to 50s, elderly population also. But even sports medicine, all depends on the realm or the type of pain that
Right.
occurs. So I do everything from orthopedic pain and sports injuries, knees, joints, hips, and shoulders. I do see neuropathic pain, which trauma, accidents,
Right.
or if they have amputees with phantom limb pain or
Okay.
CRPS. And I also see cancer pain as well, which we do see in all populations in the
Right.
spectrum. So it's a pretty large, from pediatric to adults to geriatrics,
Oh, so you see kind of the whole spectrum.
the whole gamut.
Wow.
Correct.
Wow. And obviously, going for an interventional procedure can sometimes be involved, and it probably isn't the first thing that you do, right? I mean, you
Right.
look at some other.
Right. I'm fairly conservative, so I like to start with something conservative and less invasive. If they fail the treatment for that, then I pursue the next step. I also do perform minimally invasive surgery as well for the spine,
Okay.
if needed as well.
All right.
So
So you know what? We'll be right back, and we'll talk a little bit about minimally invasive surgery for the spine. Thanks.
Excellent.
It takes more than a state-of-the-art medical facility to make a great hospital. It takes a team of dedicated medical professionals. That's the Jersey City Medical Center, Hudson County's #1 hospital. Medical teams consisting of New Jersey's top doctors, Magnet Award-winning nurses, and accomplished hospital associates, all committed to your good health. That's what you have at the Jersey City Medical Center. Make Hudson County's #1 hospital your first choice. The Jersey City Medical Center. On the web at libertyhealth.org.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Welcome back. We're here with Dr. Sheikh. We're talking about pain management. So you talked about minimally invasive procedures. Tell us a little about what that involves.
Right, so minimally invasive procedures, usually you want to have a patient that fits certain criteria. If they fail conservative management such as physical therapy, medical management, nerve blocks, or spinal epidurals, the next step is to see what's causing some of the pain.
Okay.
So I'll give you a couple examples. One is spinal cord stimulators,
Okay.
which are used for patients who've had back surgery or other surgery in the past, have lost scar, nerve entrapment, they've tried conservative therapy, and they're not getting any relief. What the spinal cord stimulator is a small device that goes in the back, and it has small electrodes on the tip of the catheter that stimulates nerve impulses, and it really replaces your painful feeling with a more soothing sensation.
Oh, I see. So is that a device that gets implanted?
It's a device that gets implanted. It's about the size of a pacemaker. It's very small.
Okay.
It goes under the skin. You really can't see it. You can feel it. It gets charged wirelessly as you watch TV.
Okay.
And with the device, the patients are usually given a small PD or handheld device that can program what side they want the pain relief on, how
Wow.
much intensity, and presets that were made once they had it placed in there. So technology for that is pretty advanced now, and we are using for multiple scenarios.
And people get relief from those devices?
They do. They get relief from the devices. And the other thing nice about the device is there's no opioid or medication narcotic use,
Right.
so their requirement for pain narcotics goes down as well.
Okay.
The other minimally invasive spine procedures are, for example, something called a mild procedure, minimally invasive lumbar decompression. And usually that's reserved for patients who have spinal stenosis, and they have an enlargement of a ligament flavum which sits in the back of the canal. So the front of the canal, if you see, if I hold a model like this is the front of the patient where the belly button is, and the back is here, the head's
Okay.
here, the feet are here. The canal, on the front end of the canal, the anterior side is where the disc sits. But on the posterior side, there's a ligament in the canal called ligament flavum. Over time, that ligament can become enlarged and start pressing on the nerves as well.
Oh, I see.
That happens over time with excessive forces. Our body's natural response is to increase tissue. When you work out the gym, your muscles
Right.
get bigger because of forces. Same thing with the ligaments, they get enlarged over time. And that can cause spinal stenosis or narrowing of the canal.
Okay.
So typically patients have to lean forward to get relief, or they're at the grocery store, they lean on the cart to get relief.
Wow.
They may walk a few blocks, their legs get heavy, they have to sit down.
Oh.
So it's usually lumbar claudication. If they qualify for that and usually get an MRI and see the thickness of the ligament flavum, about 3 millimeters thickness or so, they can go in for the procedure. And what that procedure is that we place a small instrument in the back with a small grasper, and we
Okay.
just shave down the ligament thickness. And as you do that, the decompression of the nerve occurs and the pain gets better.
Wow.
Yeah.
And people feel like immediate relief after surgery?
Usually they do feel relief immediately after.
Wow.
The best case I've had is a patient walked in with a cane and forgot the cane when he left home
Really?
in the waiting room. So they do get relief
Wow.
quite instantaneously. There are some studies that were published. There's still being more studies being published at this time to see the long-term effects.
Right.
And the last thing I also do is something called endoscopic discectomy. And what that is, if you have a disc that's bulged into your nerve and pressing on the nerve, typically, traditionally, you would have to have back surgery where you place a large scar in the back, you come down, you take off some bone, you push a dura aside, and you get the disc.
Okay.
You can have nerve entrapment and has general anesthesia requirement. With the minimally invasive endoscopic discectomies, I use a camera device
Okay.
that goes into the disc where it's pressing on the nerve and just kind of shave off that piece that's pressing on the nerve.
So you can actually see that?
You can actually see it within the camera on
Wow.
the screen, and you just take off a few pieces that's pressing on the nerve.
Wow.
The incision's about maybe 1 millimeter long, 2 millimeters long.
So rather than take the whole disc out, you can just do
Just
this
shave
minimally
off.
invasive
Right.
shaving of a
of the
piece
disc
of it.
that's pressing.
Wow.
on. I think of it more like the toothpaste comes out of the toothpaste bottle,
Right.
you just wipe it clean.
Wow.
That's kind of like what you're doing. It's done under a day procedure, under local and max sedation, and you go home the same day.
Wow.
Yeah.
That's amazing. That's
Yeah.
and people feel immediate relief
And
from
people
that.
feel relief from that too.
Wow.
As well. Sometimes they have lingering pain for a little bit for a week, which is sort of like phantom pain.
Right.
If you wear a hat for a long period of time, you take your hat off.
Yeah,
You
you
feel
still
like you're
feel
still
it.
wearing
Yeah.
it. You may have that for a few weeks, but they get results, pretty good results.
Wow,
a few
that's
weeks
pretty
after.
amazing.
Yeah.
Now, at the medical center, we have a team that's working kind of on helping patients in the hospital with pain management.
Yes.
And you're
Yes.
actively involved in that.
Yes, and that's a great program. You know, pain is one of those things where we know it can hinder rehabilitation with preventing exercise, and the range of motion functionality goes down because of pain. It's also been shown to reduce the immune system and decrease healing.
Okay.
And pain also affects psychologically the patients. They get depression. It may affect their personality, their irritability, and a lot of their family interactions and friends interactions gets affected with pain as well. So it's quite significant. And you know, the awareness of pain is really growing momentum with the healthcare community as well as the patients at large.
Right.
And the nice thing at Jersey City Medical Center, we've actually dedicated a program specifically for pain and satisfaction for the patients in the hospital.
Right.
We have a team there that's addressing all the patients' needs and providing adequate treatment and diagnosis for their pain requirements.
Yeah, you know, one of the things that's interesting you say that when we look at our patient satisfaction scores, because we send surveys out to every patient who gets discharged from the hospital, one of the things that correlates to high patient satisfaction is that we took care of their pain.
Correct.
And so there's a whole host of treatment modalities. We even have a nurse who's specialized, or a nurse practitioner who's in the hospital, right, who evaluates a lot of these patients.
We actually have 2 pain nurses that are going through all the floors of the patients and really going through and seeing how well they're doing at the time of admission and discharge. And we also have, what's nice is that even when they leave the hospital, there's some outpatient care made for them to follow even at the outpatient. So even when they leave, they're being followed and tracked and taken care of.
Oh, they are. Okay, that's good. That's really good. What do you think the success rate in the hospital is now for people who come in with severe pain? I mean, are we able to tackle this? Sometimes
we are, because now with more pain in the forefront, we're able to do more procedures.
Right.
It's multidisciplinary steps. So we get radiology involved. We'll get the OR involved. We have different specialties involved. So it's kind of a multidisciplinary group
team that
approach
kind of
that
really
helps
does
the patients get better.
You know, I know when I go in and visit patients in their room, you see that there's a scale there. You know, somebody's crying and somebody's happy, and it's the whole spectrum.
We don't like the crying. So.
No, we don't like the crying stuff, and so it looks like we're trying to move people to be more happy, and that will help improve our satisfaction.
And our goal really is to reduce the pain. Our goal mainly is to have someone function, move around, and do the things they used to love to do before the pain and feel better.
Right. Now, in the hospital, is it mostly drug treatment that we're using, or do we do some intervention?
We do. Okay. We do a mixture of both. We start with medications first.
Right.
And depending on what contraindications they have or other medical issues they have, we make a decision if we can do procedures for them and give them immediate relief, which also helps reduce the other requirements for pains and narcotic use.
Right. You talked a little bit about other modalities for treating pain, things like physical therapy. Do you use physical therapy a lot for?
We do physical therapy as well. If you look at pain in more of like a pie chart, we make certain slices of the pain. Certain slices, maybe like 30%, maybe muscle related. Okay. Maybe another 30% are nerve related. Right. And maybe the other are bone related. So the physical therapy will help address some of the musculoskeletal issues and reduce their level of pain. But of course, you still have to do other treatment modalities to help with the rest. So
it's really a comprehensive approach. It's really evaluating the patients and trying to figure out where the pain's coming from.
Right. And no 2 patients are identical.
Yeah.
You know, we have to really tailor-make each patient's treatment protocol for the best results.
Right. Well, we'll be right back, and we'll talk a little bit more about pain management.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just 1 path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want. Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just 1 path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to NewportNJ.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Seeing the ER doctor at the Jersey City Medical Center has never been easier. If you're sick, you just click. Go to libertyhealth.org, and here's how it works. Click Skip the Wait. Select your time and check in now. Enter your symptoms, your personal information. Click Proceed to Confirmation, and the doctor's waiting for you. The Jersey City Medical Center. Make Hudson County's #1 hospital your first choice.
So Dr. Sheikh, we're talking about a bunch of different kind of interventions that we use to really treat patients who are in pain. And you know, pain can be really, really complicated. You probably see a lot of patients that bounce from doctor to doctor and really just kind of look for medication to alleviate their pain. From what you've said, there's a whole host of other things that people can do, and they should really look for a pain management doctor, right? I
Correct.
mean, it's not good to be just on pain meds for the rest of your life.
Right. So some people do have this this idea in their mind that if you have chronic pain, you have to live with it.
Right.
You take medications for the rest of your life. And I do see quite a few patients coming in the office who've been there to doctors for 2 years and doctor to doctor, and sometimes a physician may not understand the level of pain or take it as seriously. Or sometimes the patient don't even talk about it.
Right.
And they may be sitting in the office with back pain, but they'll never mention it.
Right.
So it's very important actually to seek a specialist in pain because there are many options available out there for treatment.
Right.
You don't have to live in chronic pain.
And you don't have to live taking these narcotics your whole
You don't
life.
have to live taking these narcotics. Long-term narcotic use does have quite a few bad effects as well. There's addiction potential, there's dependence. Actually for men, it's a decrease in testosterone levels.
Wow.
And there's other personality changes that take place. And your relationship with the family and friends gets also affected. So there's many aspects involved with long-term narcotic use, which we don't encourage too much.
Yeah, I mean, when you think about it, being in chronic pain, the psychological aspects of that are just impact the whole family.
They really do. They really do. And some patients get very depressed because of pain.
And then they take narcotics on top of it, and that makes them further depressed.
It makes them further depressed, or they get dependent upon it, and they can't function without it. It becomes a crutch.
Wow.
And then they start becoming irritable, and they may have fights or personality changes with their family that affects the entire scope of life.
Wow.
So it's actually, in my practice especially, I don't like to encourage too much narcotic use. The interventional portion of pain management I pursue is beneficial for the patient because it fixes the source and helps alleviate the pain generation that's occurring, so they can come off some of their requirements for narcotics and opioids.
Right.
And as they can do that, they function better, they move better, and they have a clearer mind, and they live better as well.
Wow. Yeah, I mean, you think about somebody who's in chronic pain and all they're doing is taking narcotics, what the impact on the family is and on their lifestyle, their ability to work and everything else. And from what you've described, there's a whole host of things that people can do. So they really need to know about pain management specialists like you.
They really do. And I think the best thing to do is if someone is in pain and wants to pursue pain management, the best thing to do is talk to your primary care physician who are now aware of the importance of pain, significance of it, and they do work with pain specialists.
Right.
When you do go to a pain specialist, they have options for you for treatment, and you want to make sure they're well trained with the advancement of medicine. Even pain medicine, especially interventional, has advanced quite a bit. We need specialized training for it.
Right.
So a fellowship in it, board certification in it are important factors as well to look for. But you really won't get the best treatment for your pain until you see a specialist for it.
Right.
And I think the other thing is a lot of people don't know that pain specialists out there available for treatment.
Okay.
And just have to ask.
Yeah. So I'm in pain and I've been taking pain meds and I'm really sick and tired of doing that, and I want to come to somebody. What can they expect when they come to see you? I mean, you're going to kind of take a different approach than their internal medicine doctor might take, right?
Correct. So I usually do a thorough history and physical on the patient when they come in. I look at all the aspects that are involved in their pain generation and what's causing it. And I really go to the root cause of what's causing it, what's creating the pain. A lot of times things get missed because they're subtle.
Right.
For example, a patient may have hand pain, but you won't know if it's carpal tunnel, or if it's cubital tunnel, or if it's brachial plexus, or it might even be a herniated disc in the neck.
Wow.
But all they know is they have hand pain, and that can sometimes distract some other physicians from targeting what's causing it.
Right.
Or they may have some leg weakness.
And you're specially trained to be able to kind of determine where that pain's really coming from.
Correct.
I mean, that's the difference, right?
Correct. And you can pick up certain subtleties to see where it's causing it.
Right.
A weak leg may not be a stroke. It may actually be a herniated disc in the back.
Right.
So things of that nature as you do the exam and you get a history from the patient.
Right.
And as they tell you. And sometimes well, it may be obvious to me, but it may not be obvious to other people. That's why it's very important to seek a pain specialist, specialize and train in this field of medicine,
Right.
that they can pick up what's causing this pain. CRPS is also another one that's very tough to diagnose.
What's
treat.
CRPS?
CRPS stands for Complex Regional Pain Syndrome.
Okay.
And what that is basically patients who've had, let's say, an injury at work or there's something fell. They may have an abnormal distribution of pain signals being sent in their arm or their leg.
Okay.
And usually it's very increased pain on touch, so they can't sleep with the bed sheets on them.
Really?
They have swelling of the hands, they have color changes, their hair may fall off, they have swelling.
Wow.
And it's very difficult to diagnose what's causing that. And it usually may not be a herniated disc. It's actually
And
abnormal
are they in a lot
signals.
of pain? I mean,
They're in a lot of pain, and they're on high dose narcotics, and they usually see physicians and they be treated with just Percocets or oxycodone.
Wow.
And they're usually drugged up, but they still don't have full relief of the source. I actually just had a patient about a year ago who was in pain for 2 years because of CRPS in her arm.
Wow.
And I diagnosed that for her, and I did a block. It's called Stellate Ganglion block, which basically blocks a hub of nerves. It's like a train station of all nerves coming together, and you block it with Marcaine or local anesthetic. It resets the nerve firing, and the pain can get better.
Wow.
With just one block, her symptoms resolved, and she said she felt human again for the first time in 2 years.
Really?
Yeah.
Wow. That's why it's so important that people, when they have this chronic pain, they seek somebody out like you.
Correct.
I mean, you really do have the ability to kind of figure out the root cause of where the pain's coming from and
Right.
then treat it.
Right.
Not necessarily with narcotics that have all these social implications, right?
Right. There's a lot of treatment options out there. You just have to ask and pursue your physician and finding out where the best find a pain specialist.
Wow.
I have an office in Jersey City, in Rutherford, and
Okay.
Patterson as well.
All right.
And my office is open to all sorts of patients.
Now, your office in Jersey City is right near the medical center, right?
It's close to the medical center, correct?
Right.
It's right
Okay.
there.
That's good.
So patients who are from the hospital can get easy access to the office and outpatients as well.
Well, you have really done a great job of explaining to people why it's important to see a pain management specialist and that people don't have to live with chronic pain. If they go to see somebody like you, they can really make a difference in their life. They don't have to be on narcotics.
Right.
And a lot of times, the interventions that you provide in the operating room or even in your office will make a big difference in their life.
They truly do. They truly
Yeah.
And they can get back to doing things they love to do
Yeah.
and start living life again.
Yeah, because it's a debilitating thing for people to really have to live with pain like
True.
that, chronic pain like that.
True.
That's really amazing. Well, Dr. Sheikh was here with us this week. He's done a great job of explaining all the different issues around pain management. If you need a pain management specialist, Dr. Sheikh is certainly very well qualified, has great training experience, and we're glad that you're on our show this week.
Absolutely. Thanks so much.
Thanks so much.